Tibia and fibula are bones of the leg. Tibia and fibula are long bones of the leg. They have the shaft and two ends, upper and lower end. They articulate with upper and lower ends. Space between them is filled by interosseous membrane. The tibia is the second largest bone in the body, situated on the medial side in the leg. It transmits a way of the body from the femur to the foot. The fibula is the lateral bone of the leg. It is a long, slender bone of the leg, and it doesn't take part in the transmission of the body weight. Firstly, I will describe the medial bone of the leg, named tibia. The tibia is the second largest bone in the body. The first is the femur. Tibia articulates with fibula proximally and distally. It belongs to long bones, and because of that, it has the shaft and two ends. The shaft has three different surfaces: medial, lateral, and posterior. It has three borders: anterior, medial, and lateral. Lateral border has additional name. It is interosseous border. The tibia has proximal and distal end. Proximal is superior or upper end, while distal is lower or inferior end. The shaft of tibia presents three borders: anterior, medial, and lateral, and also three different surfaces: lateral, medial, and posterior. Anterior border is the subcutaneous. It extends from the tibial tuberosity to the anterior border of medial malleolus. Medial border extends from the medial condyle to the posterior border of medial malleolus. Lateral or interosseous border is sharp and extends from the lateral condyle below the facet for the head of fibula to the anterior border of fibular notch. It provides attachment to the interosseous membrane, which unites the tibia and fibula. Surfaces of shaft of tibia are medial, lateral, and posterior. Medial surface faces anteromedially. It is almost entirely subcutaneous. Lateral surface lies between anterior and interosseous borders. Posterior surface lies between the medial and lateral borders. At the upper part of the posterior surface is a visible soleal line. Medial surface lies between the anterior and medial borders. Upper end of tibia presents two condyles, medial and lateral, an intercondylar area, and tibial tuberosity. Upper end has superior surface, anterior, posterior, medial, and lateral surfaces. At the superior surface, we can see two articular surfaces that belong to the lateral and medial condyles. Peripheral flattened parts of articular surfaces are covered by fibrocartilaginous plate named medial and lateral meniscus. Between articular surfaces is visible intercondylar area. It is the rough area on the superior surface of the upper end of tibia. The middle of intercondylar area is narrow and marked by an elevation called intercondylar eminence. The medial and lateral parts of the eminence are more prominent and constitute the medial and lateral intercondylar tubercles. At the anterior surface of the upper end is located tibial tuberosity. At the lateral surface of the upper end of tibia is visible articular surface for the head of fibula. At the posterior surface is visible soleal line. The lower end presents 5 surfaces: anterior, posterior, medial, lateral, and inferior, and a downward projection from the medial part, the medial malleolus. Medial surface is subcutaneous and is continuous with the medial surface of the medial malleolus. Lateral surface of the medial malleolus is articular surface, and articular surface of medial malleolus articulates with a similar facet on the medial surface of the body of the talus. Lateral surface of the lower end of tibia presents a fibular notch. At the posterior surface of the lower end is visible groove for tibialis posterior and flexor digitorum longus tendons. At the inferior surface of the lower end of tibia is visible articular surface named inferior articular surface. This surface articulates with the body of the talus. Fibula is a long, slender lateral bone of the leg and does not take part in the transmission of the body weight. The fibula is not a part of knee joint, but stabilizes ankle joint. It consists of 3 parts. It has upper and lower ends, and also it has a shaft. Shaft has 3 different surfaces: medial, lateral, and posterior, and it also has 3 different borders: anterior, posterior, and interosseous border. The upper end of fibula presents head and neck. At the head, we can see articular surface and apex of head of fibula. Articular surface of head of fibula articulates with similar articular surface located at the lateral surface of upper end of tibia. The lower end of fibula is expanded anteroposteriorly to form lateral malleolus, which presents 4 different surfaces: anterior, posterior, medial, and lateral. Anterior surface is rough and round. Posterior surface presents a groove named lateral malleolar groove. Lateral surface is triangular and located just below the skin. Medial surface presents a triangular articular surface, and behind this articular surface is located small depression named malleolar fossa. The skeleton of the foot from behind forward consists of the following bones: tarsals, metatarsals, and phalanges. There are 26 bones in the foot. At the foot, there are two different surfaces: dorsal surface and plantar surface. Foot also has two different borders: medial, longer border, and lateral, shorter border. There are 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. Tarsal bones are short bones. They are organized in two orders: proximal or posterior and distal or anterior order. In the posterior order of tarsal bones are located talus or ankle bone and calcaneus or heel bone. Talus is only bone of the foot that articulates with bones of the leg, while calcaneus or heel is the biggest bone of the foot. In front of the talus is located navicular bone, while in front of the calcaneus is located cuboid bone. These two bones, together with 3 cuneiform bones, form distal order of tarsal bones. There are 3 cuneiform bones: medial, intermediate, and lateral cuneiform bone. In front of the tarsal bones are located metatarsal bones. Metatarsal bones are long bones. They have 2 ends. Posterior end is base, while anterior end is head. And also between 2 ends is located the shaft of metatarsal bone. The biggest metatarsal bone is the first, while the longest metatarsal bone is the second metatarsal bone. And there are 14 phalanges. Phalanges are also long bones. They have base or posterior end, they have anterior end or head, and they have also shaft. There are proximal, middle, and distal phalanx. Great toe has only proximal and distal phalanx. At the plantar surface of the foot, there are 3 different arches. Transverse arch connects head of the first and fifth metatarsal bone. Besides transverse arch, there are 2 longitudinal arches, medial and lateral, or internal and external. The medial longitudinal arch connects the head of the first metatarsal bone and the heel, while lateral longitudinal arch connects head of the fifth metatarsal bone and the heel. Talus or ankle bone is the only bone of the foot that articulates with bones of the leg. It is the second largest bone of the foot. It lies above the calcaneus like a rider, hence highest bone in the skeleton of the foot. The main parts of the talus or ankle bone are head, neck, and body. Talus belongs to short bones, and because of that it has 6 different surfaces: superior, inferior, anterior, posterior, medial, and lateral. At the superior surface, is visible superior articular surface that articulates with inferior articular surface of the lower end of tibia. At the lateral surface of talus is visible articular surface with lateral malleolus. This articular surface articulates with articular surface located at the lateral malleolus of fibula. At the lateral surface of talus is visible small process named lateral process of talus. At the medial surface of talus is visible articular surface with medial malleolus. This articular surface articulates with articular surface of medial malleolus of tibia. At the anterior surface of talus is visible articular surface for navicular bone. This articular surface articulates with navicular bone. At the posterior surface of talus is visible posterior process of talus. It consists of medial and lateral tubercles. At the inferior surface are located three facets for articulation with calcaneus or heel. Their names are anterior, middle, and posterior calcaneal surface or facet. Between middle and posterior calcaneal surface is visible groove of talus. Calcaneus or heel bone is the largest and most proximal bone of the foot. Calcaneus or heel bone belongs to short bones, and because of that it has 6 different surfaces. Here you can see superior, lateral, and posterior surface. At the superior surface are visible 3 different facets for articulation with the inferior surface of talus or ankle bone. The names of these articular surfaces are anterior, middle, and posterior talar articular surface. Between middle and posterior talar articular surfaces is visible calcaneal sulcus. At the lateral surface of calcaneus is visible small eminence, small prominence. The name of this structure is fibular trochlea. Below fibular trochlea is visible groove for tendon of fibularis longus muscle. At the posterior surface is visible calcaneal tuberosity. At the medial surface of calcaneus is visible structure named sustentaculum tali. Below sustentaculum is located groove for tendon of flexor hallucis longus muscle. At the inferior surface is located calcaneal tuberosity. At the anterior surface is located articular surface. This articular surface articulates with cuboid bone.